All right, here we go with the equipment section for the long arm posterior splint. You'll need gloves, scissors, ace bandage, rolls of plaster 3-4 inch, depending on your patient's size, tepid water, no hot, cotton 3 or 4 inch, depending on arm size, and stockinette. Of course, the stockinette is optional. You could just go with the cotton, and that's it. This is going to be the padding portion for the long arm posterior splint. We already have our demo patient ready to go. He is sitting on a table with a bump. We will put down a chucks pad because we're nice and we're not going to get him all plastered up. If this is not a position you can get to, or they're a gurney patient, wheelchair patient, you would of course have to reposition them, maybe take the side of the wheelchair off, or have another tech come hold, or put them in traction to uphold this position for you. After that, I get him in an arm wrestling position. If he can tolerate it, of course our demo patient's more than willing to tolerate it. He has no injury, but if your patient is in a lot of pain, you will have to work around their position and be very gentle as you slide stockinette on, or you can skip stockinette in certain situations if you don't have it and just go straight to the cotton. But as you see in the video, we are going to slide it all the way up. We are going to cut around that CMC joint a hole, pull it away from the body and cut it. That way you'll be able to slide the thumb through there. But before you slide that thumb through, make sure you come on down the antecubital fossa, or the anterior portion of that elbow where everything wrinkles up, and cut that out. That can bunch up and cause irritation to your patients. So it is important to make sure to cut that out and get it to lay nicely. Once you do have that cut out, you can pull it down. You might need to recut after you do this, but it helps sit that thumb sock down nicely, and it makes for just a better lamination of that sock. You could have done straight cotton, as I said, and then you wouldn't really have to cut anything out of there. But I do like stockinette. It makes a much cleaner splint or cast. I do double over my stockinette. You don't have to for the splint. There's nothing going down that portion of the anterior part of the arm. But I've gotten habitually used to using that, so I do a double and then I cut. This gives a nice padded thumb sock that I'll be able to pull down over the cotton. You can also fold that into the inside or tape it down if you so please, depending on your patient and compliance. Next, you can do 3 or 4 inch cotton. I chose the 3 inch. Then I'm going to go at the wrist. You could also start at the fingers if you wanted to, but definitely start distally and work your way proximally. This is an endpoint at the palmar crease on the posterior side here, so I do put 3 layers. But after that, I stick pretty much to a 50-50 in this area. If you do pad a little bit extra, it's fine. The splint, so swelling's our primary concern, and then stabilization, of course, is second. Doing 50-50 and just showing I'm not having many shadows, because you definitely at least need that 50-50 cotton roll. This part, you can put the patient on either the bump of the cotton and area you finished, or have the patient hold with the good arm. Now, as you come through this area, you want to fan fold some layers onto that olecranon, because it's very bony in the back of that elbow. So make sure to fan fold an extra 2 to 3 layers there. Don't just keep rolling around, just fan fold it in there so it's specifically on that elbow, on the olecranon. Then keep going up the bicep 50-50. Again, end point at the back is going to be that deltoid insertion. So make sure you add 3 up there as well, so you'll have a nice, clean, soft fold back for the patient. That's it. Okay, so section 3 is going to include the plaster portion for the long arm posterior splint. I am going to use the plaster to measure. You could use cotton, but it tends to stretch and it tends to throw off your measurements. That's the deltoid insertion. We're going to measure posteriorly from that deltoid insertion all the way to the palmar crease. At this point, you need to roll fan fold out. We are doing rolls. If you have slabs of 4 inch that are long enough, you could use them. But rolls are really nice because you can just use them to measure. They don't stretch. They give you a pretty good measurement. And if you're a little bit long, which I tend to be a little long because you can fold it, that's even better. Leave yourself at least a couple extra finger lengths so you are not short. So if you're short, you will be redoing the splint. I also recommend to be closer to the 15 layers of plaster rather than the 10. I know it's 10 to 15 is the ballpark you're aiming for, but this splint tends to break, especially if the patients are non-compliant or they're doing too much leaning on the olecranon area. And once broken, of course, it loses its structural integrity. It doesn't hold very well. It becomes very flimsy. So aim for 15, putting them in the sling, letting it fully dry is the best bet. And make sure you have that 90-degree angle, unless otherwise told, of course, by your provider. Give that plaster a good squeeze so you can get that plaster ooey-gooiness to laminate all over, and then take your fingers and laminate it down so you're filling in all those pores in the plaster sheets and molding them together. Now this time, not all the time does the plaster stick nice and easily to the patient, but my demo patient actually had a pretty good stickiness to the plaster, so I didn't have to anchor. But say it was trying to fall off, you could take just one wrap around the top to help hold if you didn't have somebody helping. Also, make sure these ends are evenly lining up, so it's not just tilted medial or laterally. It's lined up pretty evenly across that olecranon on both sides. I used 4-inch. You could even use 5 if you wanted to make it even thicker and take up more surface area. 1 layer of cotton should be enough to tack it on. The patient's holding the fingers to keep position for that 90 degrees, and I'm putting a little extra at the top because that is an endpoint for this splint. This will be the folding and finishing section, which is the last section for the posterior long arm plaster splint. I folded the padding individually, and then I folded over the stockinette. Now I'm going to trim around the PIP joint. Then I'm going to cut off any excess stockinette I don't want. I'm going to fold back some padding and cut down the side a little bit so I can fold it. If you're long a little bit and up the fingers too much, because you shouldn't be encroaching the fingers, you can trim it down like I did and add a little bit extra padding so you're not digging into their palm. You want that to be soft because that, like I said, is another endpoint. Then I took that piece that I cut and folded it over, and now I'm making sure that my endpoint is good. It's nice to the skin. I'm folding my thumb. Again, it's a double stockinette thumb. Didn't have to be. There's nothing over there for the splint. And I'm going to use a double 4-inch ace wrap. The double 4, which is just pretty much the double length, it's a 10-yard rather than the 5-yard normal ace wrap. It tends to reach all the way. If you use just a normal 4, which is 5 yards long, you might not make it all the way and need a second one. So the double 4 tends to make it from all the way from the wrist all the way up the arm. Patient's holding, her bump has fallen, but as long as you have a cooperative patient like my demo patient, they can hold the fingers and hold your 90-degree position. Once you make it all the way up, you can attach the end Velcro, and then you will continue holding till this sets, at least initially sets. You can put them in a sling if they're in a hurry so that can hold the position for you. But you definitely need to maintain that 90 degrees unless otherwise told by a provider. And that's pretty much it. Congratulations, my demo patient. Thumbs up. Good job.